صباح الخير everybody. Good morning. كيف حالكم كويسين؟ طيب, today's talk is rather simple. We contemplated whether or not we should get this, but we thought might as well we get it. And we don't know. Do we have rabies in Jordan? Wallahi, we don't know. Nevertheless, we will go ahead and cover it. What do you see on the slide? We see an MRI of some sort for a human brain. مش هيك؟ صح؟ شايفين شو شايفين ولا مش شايفين؟ Yeah, so you can see an MRI for human brain with some lesions are pointed out by arrows. مش هيك? That's what you're looking at. So let's dive in to the rhabdoviruses. Rabies is one. We'll define it. We'll talk about the epidemiology, the microbiology, diagnosis, management, and prevention. وأهم شيء with the prevention is the pre-exposure prevention and the post-exposure, believe it or not, prevention. So let's get into it, and after we finish rabies, we'll discuss some of the arboviruses that are relevant, especially SARS-CoV-2. So let's get into it. Definition: rabies. شو يعني rabies بالعربي؟ So it is an animal-sourced infection that causes a nervous system itis, an itis of some sort, in this case encephalitis, with neurotropic. يعني neurotropic شو يعني tropic؟ يعني بحب the neurons. في lymphotropic for neurotropic, في kidney tropic, okay? So the niche in which the virus or this microorganism would flourish. So there's a tropism, yeah? So that's trophic means. Ophelidae viruses genus and the Rhabdoviridae family. Okay? So you shouldn't memorize these names, okay? But you should make it sound familiar. So when you go home and study this stuff, you enjoy it, you have fun with it. Whether you teach it to your mom or to your little ones or watch a video or something, this way you make it more familiar, and then when you see these names on the exam, you are able to recall and answer because it's an MCQ, right? So you shouldn't be memorizing stuff. So thank you for attending today. It is the highest case fatality, one of the oldest human diseases that kills. Okay? And people die from the disease, and that's why I thought we'll go ahead and give this talk today. Okay? Dogs continues to be globally, huh? وليش بحكي هيك؟ Alright, so dogs continue to be globally the primary source, and that's why we do a control of some sort for the stray dogs in Jordan, صح؟ كان عليها debate كتير, صح؟ Do we shoot them? We don't shoot them. Do we poison them? We don't poison them. Do we sterilize dogs? مش هيك؟ وat the end صار في محميات وجمعيات to sterilize dogs to prevent the spread of stray dogs or to control their populations. هذا اللي صار بالأردن، وأنت بتعرفوا سمعتوا بالأخبار صح؟ هاي اللي بحكي عربي بقول ما بحكيش عربي، هاي اللي بحكي عربي. One interesting one is the tissue and organ transplant in terms of epidemiology. So billions of people are affected by this disease. Good? هلا راح نحكي human rabies وراح نحكي animal rabies. Now we're more interested in the human rabies, nevertheless we'll talk about both. I'm proud of you today, حقيقة. طيب, بعرف جاي أكثر شوي. So total human cases. So, I mean, long story short, if you look at this graph, you can see a drop in the cases, whether it's human to domestic animals, total pets, and other wild animals. Overall, the trend have declined significantly. And this is because of successful preventative measures, okay? So dogs, so this is the point I wanted to make. Area on, we said globally, dogs are the primary cause, مش هيك? So in the United States, for those who are interested in the board exams, you probably have been watching the news and you've seen a lot of Jordanian medical graduates have matched into residency, and that's really great, and we encourage all of you and spark an interest in you to start preparing for that, and it would really help you. In the States, dogs are only 0.3%. Only 0.3%, right? Whereas other animals are taking up the other majority. Bats, raccoons, skunks, and foxes. They're shiny skunks. So bats, raccoons, skunks, and foxes are taking up a majority of this. طيب سؤال الامتحان مش مكتوب. ضمنوا حاضرين اليوم. خير اللهم اجعل. What about squirrels? What about rodents in general, including squirrels? Must be important, huh? Like, do they pose a risk? Question, exam question. Yes or no? Guess, take a wild guess. Wala guess. Yes wala la, wala la. Yes? No. So rodents and squirrels do not pose a risk. So you can feel safe going to the park, in a few parks, with a few squirrels in the parks, and pet them. طيب بس نرجع نسأل عن التليفون إن شاء الله. It's not that heavy. So to the point, because of the board exams, and it is what it is. I'm teaching you from Mandel, so that's where I get my information. So we don't really, or we may do, and I don't know, have epidemiological data for rabies in Jordan. Nevertheless, إذا نحكي globally, and for those interested in the board exams, إذا الامتحان بيسألك raccoons, or raccoon bite or a fight, they do fight. شايفين الراكون? They have human hands. هذا شايف raccoon? No. For your fun and enjoyment, when you go home today, look up a raccoon and see they do have a human hand. Subhanallah. They have fingers that look like this. خير يا سوار إن شاء الله خير على التليفون في شيء؟ لا. بسيط. So raccoons, skunks, they take up the majority, and you can see a spike in the early 90s with raccoons. So that remains true, and then we do have another table in which we categorize these animals, wild animals, and I know we agreed already 0.03 or 0.3 or 0.3% dogs only, unlike the global trend. So these are the very high risk animals and moderate to low. And you can see the dogs are fitting in the moderate to low category. So this is the animal rabies. You see, the viridi is a bullet-shaped virus. It is an RNA virus, okay? And the rest is details. So here is a list of the member of the Lysoviridae genus that could cause rabies. لا تحفظوهم, okay? Just read through it, make it familiar to you, and that's that, including the reservoir, okay? So if I talk about the first one, which is rabies, the one we're discussing today, bats found wild except in Antarctica, New Zealand, Sweden, Norway, Spain, Taiwan, Japan, and some islands. So for the most part, bats have a global distribution, and they do carry the virus. I thought it's interesting and fun, so I thought I'd put it here. I might ask you about this. ما راح أسألكوا أرقام, ما راح أسألكوا dimension, but all in all, we should know it's an RNA virus. And then when we نعمل diagnoses, we shouldn't be running a PCR. We should be running what? An RT-PCR. Okay, bullet shape with different dimensions, and here is the image with the coiling, and then you can see the RNA, single strand RNA virus. Interesting, صح? Bullet shape. I thought it's interesting, so I'll put it out here. The pathogenesis, the natural infection, the natural trend in history of the disease, causes or impacts the central nervous system. These are the sequential events of the pathogenesis, okay? Starts from the entry into the neuron that expresses acetylcholine. وين هذا النيورون اللي expresses acetylcholine؟ وين؟ على النيوروماسكولار junction، مش هيك؟ Normally that's where the acetylcholine being released على السينابتيك كليف بين النيرف اند والمصل صح؟ تعرف هذا الحكي مشان؟ Once it's bound to the acetylcholine receptor, okay, it internalized through receptor-mediated endocytosis. It is a clathrin-mediated. مثل الفلو. تعرفوا الفلو how the flu virus gets into the cell? It's internalized through endocytosis with clathrin-mediated. The clathrin بيعمل structural changes. It opens up. It engulfs, subhanallah, the virus, and then it internalizes. And that's the endocytosis of the story. Through this receptor, ممكن أسحبه على الريسبتور. Okay. After internalization, it goes to the endosome, trafficking to the microtubules, the actins وهدول of the cytoskeleton. Excuse me. And then it acidifies, and then the particles release into the cytoplasm. And that virus, rabies or not, all viruses has a common feature, whether they're DNA viruses, whether they're RNA viruses. They lack a replicative machinery, صح? So, in order for them to survive or to multiply, they will have to hijack the post-replicative machinery so they can replicate and then exit the cell through release or bursting out the cell and then being released. Okay? And then the viral load will increase. And then the manifestation of the disease will increase. But one thing you should know about rabies, وهاي مهمة، طب خلينا نحكيها then you will see it's not coming yet. واحد ماشي بأمان الله عض stray dog بالأردن صح؟ The dog was drooling وكليرلي عليه signs and symptoms اللي احنا بنعرفها عن داء الكلب هاي بالعربي. Okay? If you intervene soon enough, you are able to save that person. ليش؟ لأنه الفيروس to pick up the viral load and to do what I just explained in terms of attaching to the acetylcholine receptor, internalized through clathrin-mediated endocytosis, go through the build up the viremia or build up the viral load. Okay, it takes time, and that time is rather precious. It is the window of opportunity to intervene with whatever guns you have to prevent and save that subject's life. مثل الثرومبوليتيك ثيرابي تبع الستروك. More or less. فهلا when we come to the management, you'll see that, and just remember that for rabies, for your own clinical practice down the road when you become, inshallah, full-blown doctor. Right. So we just talked about how the virus gets in. يعني من هالسلايد اللي بيسألني شو ندرس. Look into it, read through the slide, enjoy it, have fun with it. Just know this, okay? Acetylcholine receptor, clathrin-mediated endocytosis. This is what I want you to know for the pathogenesis of the virus. Now, the other thing that I want you to know about the pathogenesis of the virus is the title and the image, and it is eosinophilic. So, the negri bodies is the microscopic pathology of the virus with the encephalitis as the itis or the disease causing. As you can see, بالPurkinje, cerebral Purkinje cells, oval, eosinophilic, cytoplasm inclusion bodies, and that's that. Tamam? That's it. Eosinophilic inclusion bodies in the Purkinje cells, that's the pathology. That's what I showed you with MRI. That negri bodies. But even if you see a negri body, even when you see a negri body, and I'm not saying dogs, I'm not saying skunks, I'm not mentioning anything, know that we are talking rabies, okay? واضح? Negri bodies, unique, pathognomonic, characteristic of the disease. طيب, the manifestation, سمعين Guillain-Barré syndrome, that's one. So you go home now, enjoy Guillain-Barré, see what is Guillain-Barré and how it starts, and rabies could manifest and mimics a Guillain-Barré and heart involvement, such as myocarditis, okay, and then it presents an hyperacetylcholinergic status, such as the pheochromocytoma, okay, or tetanus. Tetanus امبارح درسناها صح؟ Were you here for tetany? No. Few of you were here. It's fine. So yesterday's talk was rather easy. حكينا tetany, botulinum, and what else? حكينا شوية listeria. وحكينا على leprosy. The lepromatous and the tuberculoid form of leprosy for those who did not come yesterday. طيب. حكينا عن mechanism of action that wasn't written in the slide, صح؟ صح. طيب. So, as I said, what I was mentioning earlier, the virus needs time to build up. So that's your incubation period. The incubation period, less than 30 days, and sometimes, or most commonly, بدها 30 ل 90 يوم, 30 to 90 days. 50% of the cases, they need that incubation before the prodrome and the early symptoms starts in the form of pain, fever, malaise, anorexia, nausea, vomiting, the acute neurological manifestation at 2 to 7 days with hallucination, bizarre behavior, biting, and agitation, and hence the name, that killer, check. And the subject starts biting. Yeah, شايفينه بالموفيز ولا لا؟ لأنه hallucination و agitation starts biting and hydrophobia. شو يعني hydrophobia؟ بخاف من الماء. Okay. And so on and so forth. And paralytic rabies, ascending flaccid paralysis. يعني, in other words, he starts really anxious or agitated, hallucinating or biting. وبعدين, when the disease progresses, he goes into the paralysis phase of the disease in 2 to 7 days, and then coma and death, unfortunately, in a couple of weeks. So, the window of opportunity, the precious period that ranges or varies from less than 30 days to up to 90 days, or 1 year even in some cases, but most common, 50% of the cases that was reported and documented, thanks to them, so we can spread the knowledge to you guys, اللي هو 30 to 90 days, in which we follow the protocol that I'll show you here in a minute, including watching or observing the animal who bit that subject, so we would know how to deal with the disease. Okay? So I encourage you to read through this and understand it. Nothing to memorize, really. In hallucination or biting, you already know. Flaccid paralysis is the following step, and then coma and death. That's it. You announce the patient gently to the family, and that's that. Okay? So diagnoses, comes without saying. We know that diagnoses in this case would pertain history of a bite or a fight with a wild animal, right? You've seen a lot of videos on how she's trying to get the raccoon out of the trash bin, for example, right? هو في شوية scratching إلى آخره. The clinical manifestation is key, and the long story short, the direct immunofluorescence, the skin, the biopsy. The question that I might ask will be an RT-PCR because it is an RNA virus. Check. So we don't do a PCR, we do a reverse transcriptase, so we can get the cDNA and run it. Okay? Prevention, exposure prevention. Okay, and there are committees for that. Well, interest, طبعا unfortunately it is what it is because of the bat rabies. The interest is all about bat rabies in the United States and post-exposure prophylaxis. Okay, and the pre-exposure prophylaxis for the high-risk group. mean high-risk group? People who deal with wild animals, you can imagine. يعني vets والناس اللي بيشتغلوا بالzookeepers, مش هيك؟ Yeah? And people who like to wander a lot in nature. So get yourself taken care of. Now, what I'll leave you with, rabies, is the algorithm. وهاي مسألة كثير على البورد exam. اللي هي شغلة to treat or not to treat. Part of it was, a lot of times, the correct answer على البورد exam بكون watch the dog or watch the animal, whether or not the animal will develop the disease. So go through the algorithm. Nothing to memorize here. It's just for your understanding, okay, to know when to treat and when not to treat, okay? So that's the algorithm for the human rabies post-exposure prophylaxis, okay? In high suspect animals, you should start immediately with the management because of the precious window of opportunity. Unfortunately, there is no proven antiviral therapy. Okay? And most of them die, زي ما حكيت, within a couple of weeks. That's rabies. We conclude with rabies. I hope you enjoyed it and have fun with it. رح نحكي quickly or briefly على الارboviruses, the tick or flea-borne diseases, and the ones that I wanted to discuss. طبعا there's a lot of them obviously, but the one that we want to discuss is Zika virus. انتشر كثير وسمعنا عنه كثير مش هيك؟ Especially when Latin America مش هيك؟ شو المين feature? It's the kid you're looking at in the image. What's wrong with this newborn? The مش هيك؟ microcephaly, congenital microcephaly, and associated mental retardation, and so on and so forth with this disease. And it is an RNA virus, so the diagnosis will be with an RT-PCR. So that's Zika. كلمتين حكيت على Zika, صح? That's it. That's all you need to know. على SARS-CoV-2, you should lecture me on SARS-CoV-2 because we lived in it for 3 years, right? And it is an RNA virus. The story starts in Wuhan, China. God knows what happened. There is a debate whether or not this was implanted or it was a crossover from animals to human. Nevertheless, we got SARS-CoV-2 with the full-blown picture and manifestations of it. And the angiotensin converting enzyme 2 راح تسألوا عنه بالامتحان. ليش؟ ليش يا دكتور؟ لأنه when we did our epidemiological data, and we continue to do. I'm looking up, I'm studying right now as we speak over 12,000 cases that we followed up over 5 years before and after the vaccine. We're trying to understand this pandemic so we can prepare and try to do a better job in the next pandemic. Is there a next one coming? Most likely yes. Okay? But I'm working with a team of bioinformaticians to do some deep learning modeling. Artificial intelligence, some deep learning to train and test models so we can predict the next pandemic and do a better job. The long story, the story I'm trying to tell you, in Middle Eastern people with Middle Eastern origin, they found that they have less expression of this enzyme, of this receptor, on the surface of the respiratory cells, angiotensin 2, and thereby the entry virus was less, and the fatality and the severity of the disease among Middle Eastern was overall less. تمام؟ Quite a lot of people in Italy, a lot of people in Europe, a lot of people in Africa, a lot of people in Asia, a lot of people in the US and Northern America. Nevertheless, in the Middle East, subhanallah, alhamdulillah, شايفين? It was less because of the expression of angiotensin converting enzyme 2 on the respiratory cells of people of Middle Eastern origin and أقل. But I will leave you with this and I will test you on what is the virus or what is the receptor that the spikes will bind to of SARS-CoV-2. 1 minute, okay, to get and cause the disease. So early infection, pulmonary manifestation, and هلا we are dealing with the fogginess, the post-COVID sequelae. Number 1, brain fogginess. يعني the post-exposure complication or long-term sequelae of someone who got the disease. COVID-19 disease, مش هيك؟ Brain fogginess, headache, loss of taste and smell, and liver manifestations. These are the 4 that we deal with, and this is the windows and the reconvalescence and the disease progression throughout. يعني كل flu-like, but more severe, uncontrolled temperature, high fever, malaise, fatigue, and so on and so forth, leading in some cases, especially those at risk, elderly people with respiratory disease, to die from secondary complications. Okay? The protection, كلكم شاطرين بتعرفوا the protection that we dove deep dive into this and and the manifestation, as I said, and normally how people die. It's true, and I'll finish with this. We don't die from a bug infection, okay? The bugs are in it for fitness and survival. They infect you so they can replicate, they attach, colonize, become bigger, larger, so that's fitness and survival, and then they disseminate. And this is true for all infections. طيب شو الستوري هون؟ This story is your immune response. Okay? If you have unbalanced, weak, less robust immune response, you can end up in a chemokine, cytokine storm that leads to extravasation of fluids, starting the manifestation of shock, including disseminated intravascular coagulopathy, DIC, leading to septic shock, اللي هي hypotension, tachycardia, hypothermia, and then death. The disease number one that you might be asked, you ايش؟ pneumonia, صح؟ Okay. And it has a lot of extra pulmonary manifestation. Again, I'm proud of you. ما بتحضر والله حضور كويس. يعني you can read the slides on your own. You can get the science from anywhere. But you come for the interaction. You come for the show. If you really attend, you are able to go through the slides much quicker. You are interacting with the presenter, in this case, حضرتنا, Sheikh. So you can ask questions and make it more conceivable, hopefully more enjoyable, fun, a bit clear. أسئلة? Any questions? And we end with vaccination. Vaccination. MMR causes autism. لا, MMR doesn't cause autism. وعملوا big long study على MMR, صح؟ عشان يحكوا للناس إنه ما تعمل توحد. Vaccination, vaccination, vaccination. We are clinicians, we are scientists above all. وفوق كل ذي علم علم. فإحنا when we see the science and we adapt to the science. بوليو شلل الأطفال. بالسبعينات دمر اوكي تعرفوا البوليو فاكسين من امتى معروف؟ من الخمسينات ومن الستينات بس a lot of countries did not adapt to it. يقول لك هاي الارواح الشريره بتعمل بوليو اوكي تام الناس اقتنعت تام انه لل70 ولا 5 وبالاردن لل80. طب احكي لكم ستوري ما فيش داعي احكي ولا احكي لكم. طيب على السريع خلصنا. I know one of my relatives, his mom الله يرحمها, she refused تعطيه polio shot. ولليوم هي he suffering from a sequelae, you know, عنده عكاز ولليوم بتعكز عليه. And one leg is paralyzed because of the myth. Because احنا يعني ديننا وكلتشرنا بيدعو الى ايش؟ Adapting science. So vaccination is important, including the COVID vaccine. That most of us are vaccinated. Thank you very much. I hope you enjoyed the talk and the interaction. And we'll see you when I see you.